Are you experiencing unexplained weight gain, fatigue, or abdominal pain? These could be signs of a serious health condition known as fatty liver disease. This silent disease affects millions of people worldwide and often goes undiagnosed until it has progressed to a more advanced stage. In this video, we will explore 10 shocking signs that could indicate the presence of fatty liver disease. By recognizing the signs of fatty liver disease early on, you can take proactive steps to protect your liver health and prevent the progression of the disease. From yellowing of the skin and eyes to abdominal swelling, we will delve into the various warning signs that should prompt you to seek medical evaluation. Don't wait until it's too late. Hold on to this video to discover the shocking signs that could indicate fatty liver disease and take control of your liver health today. What is fatty liver disease? Fatty liver disease, also known as hepatic steatosis, is a condition characterized by the accumulation of excess fat in liver cells. This buildup of fat can lead to liver inflammation, scarring, and impaired liver function. There are two main types of fatty liver disease: alcoholic fatty liver disease and non-alcoholic fatty liver disease. Alcoholic fatty liver disease is caused by excessive alcohol consumption over an extended period of time. Alcohol is toxic to liver cells and can lead to fat accumulation and inflammation. Non-alcoholic fatty liver disease, on the other hand, is not related to alcohol consumption. It is commonly associated with obesity, insulin resistance, diabetes, and metabolic syndrome. Non-alcoholic fatty liver disease is becoming increasingly prevalent and is considered one of the leading causes of liver disease worldwide. Risk factors for fatty liver disease. Several factors can increase the risk of developing fatty liver disease. Understanding these risk factors can help individuals take proactive steps to prevent or manage the condition. Obesity, excess body weight, especially around the abdomen, increases the risk of developing fatty liver disease. Obesity is closely linked to metabolic syndrome and insulin resistance, both of which contribute to the development of non-alcoholic fatty liver disease. Type 2 diabetes. Individuals with type 2 diabetes are more likely to develop fatty liver disease due to insulin resistance and metabolic abnormalities. High cholesterol and triglyceride levels. Elevated levels of cholesterol and triglycerides in the blood can contribute to the development of fatty liver disease. Metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes obesity, high blood pressure, high blood sugar, and abnormal cholesterol levels. Having metabolic syndrome increases the risk of developing fatty liver disease. Excessive alcohol consumption. Alcohol abuse is a leading cause of alcoholic fatty liver disease. Consuming more than moderate amounts of alcohol can lead to fat accumulation and liver inflammation. Certain medications. Some medications, such as corticosteroids, tamoxifen, and methotrexate, can increase the risk of developing fatty liver disease. Common symptoms of fatty liver disease. Fatty liver disease is often asymptomatic in its early stages, which makes it challenging to diagnose. However, as the disease progresses, certain symptoms may start to manifest. Here are some common signs and symptoms associated with fatty liver disease. Fatigue. Feeling excessively tired and lacking energy is a common symptom of fatty liver disease. This fatigue can be both physical and mental. Unexplained weight loss or gain. Fatty liver disease can cause unexplained weight loss or weight gain. The weight loss may be due to a loss of appetite or the body's inability to properly absorb nutrients. On the other hand, weight gain can occur due to metabolic abnormalities and fluid retention. Abdominal discomfort. Some individuals with fatty liver disease may experience mild to moderate abdominal pain or discomfort. This discomfort is often felt in the upper right side of the abdomen. Yellowing of the skin and eyes, jaundice. Jaundice occurs when there is a buildup of bilirubin in the blood, resulting in a yellowing of the skin and eyes. Although jaundice is not always present in fatty liver disease, it can be a sign of more advanced liver damage. Swelling in the legs and abdomen. As liver function becomes compromised, fluid can accumulate in the legs and abdomen, leading to swelling and discomfort. Dark urine and pale stools. Changes in urine and stool color can occur in individuals with fatty liver disease. Dark urine may indicate the presence of bilirubin, while pale stools can be a result of decreased bile production. Shocking signs that could indicate fatty liver disease. 1. Spider veins. The appearance of spider veins or small, dilated blood vessels near the surface of the skin can be a sign of liver dysfunction and fatty liver disease. These veins often appear on the face, chest, and legs. 2. Easy bruising. Individuals with fatty liver disease may notice that they bruise easily or that bruises take longer to heal. This is due to impaired liver function, which affects the body's ability to produce clotting factors. 3. Mental confusion. Fatty liver disease can lead to a condition called hepatic encephalopathy, which affects brain function. Mental confusion, forgetfulness, and difficulty concentrating are common symptoms of hepatic encephalopathy. 4. Gynecomastia. In males, fatty liver disease can lead to hormonal imbalances, leading to the development of breast tissue. This condition is known as gynecomastia and can be a surprising sign of liver dysfunction. 5. Red palms. The palms of the hands may appear red or flushed in individuals with fatty liver disease. This redness is caused by expanded blood vessels and can be a result of impaired liver function. 6. Nosebleeds. Fatty liver disease can cause increased blood pressure in the liver, leading to the development of enlarged blood vessels. Nosebleeds may occur as a result of these swollen blood vessels. 7. Unexplained muscle weakness. Fatty liver disease can affect muscle function and lead to unexplained weakness and fatigue. Individuals may find it challenging to perform daily activities that were once effortless. 8. Excessive sweating. Excessive sweating, especially at night, can be a sign of fatty liver disease. This symptom may be accompanied by other signs of liver dysfunction, such as jaundice or abdominal pain. 9. Loss of appetite. Fatty liver disease can cause a loss of appetite, leading to unintended weight loss. This symptom can be particularly concerning if it persists for an extended period. 10. Personality changes. As fatty liver disease progresses, it can affect brain function and lead to personality changes. Individuals may become more irritable, moody, or experience changes in behavior and cognition. Lifestyle changes to prevent and manage fatty liver disease. Making certain lifestyle changes can help prevent and manage fatty liver disease. Here are some recommendations to improve liver health. 1. Maintain a healthy weight. Losing excess weight and maintaining a healthy body weight is crucial for preventing and managing fatty liver disease. Focus on a balanced diet and regular physical activity. 2. Eat a nutritious diet. Consume a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit your intake of processed foods, saturated fats, and added sugars. 3. Limit alcohol consumption. If you have alcoholic fatty liver disease, it is essential to limit or eliminate alcohol consumption altogether. Seek professional help if you struggle with alcohol abuse. 4. Exercise regularly. Engage in moderate-intensity aerobic exercise, such as brisk walking or cycling, for at least 150 minutes per week. Regular exercise can help reduce liver fat and improve overall health. 5. Manage underlying conditions. If you have conditions such as obesity, diabetes, or high cholesterol, work with your healthcare provider to manage and control these conditions effectively. Dietary recommendations for fatty liver disease. In addition to lifestyle changes, certain dietary modifications can aid in the management of fatty liver disease. Consider the following recommendations. 1. Increase fiber intake. Fiber-rich foods, such as fruits, vegetables, legumes, and whole grains, can help improve digestion and promote liver health. 2. Choose healthy fats. Opt for healthy fats found in foods like avocados, nuts, seeds, and fatty fish. These fats are beneficial for liver health and can help reduce inflammation. 3. Avoid or limit added sugars. Added sugars, especially high fructose corn syrup, can contribute to liver fat accumulation. Limit your intake of sugary beverages, desserts, and processed foods. 4. Moderate coffee consumption. Studies have shown that moderate coffee consumption may have protective effects on liver health. Enjoy your coffee in moderation, but avoid excessive caffeine intake. 5. Stay hydrated. Drinking an adequate amount of water helps support overall liver function and aids in the elimination of toxins from the body. Medical treatments for fatty liver disease. In more advanced cases of fatty liver disease, medical treatments may be necessary. These treatments aim to manage underlying conditions, reduce liver inflammation, and prevent further liver damage. Depending on the severity of the disease, healthcare providers may recommend the following. 1. Medications. Certain medications may be prescribed to manage underlying conditions, such as diabetes, high cholesterol, or elevated blood pressure. 2. Antioxidant supplements. Antioxidants, such as vitamin E and selenium, may be recommended to reduce oxidative stress and inflammation in the liver. 3. Liver transplantation. In severe cases of liver damage, a liver transplant may be necessary. This procedure involves replacing the damaged liver with a healthy liver from a donor. It is essential to work closely with your healthcare provider to determine the most appropriate treatment plan for your specific condition. Fatty liver disease is a serious condition that can have significant implications for liver health. By recognizing the signs and symptoms of fatty liver disease early on, individuals can take proactive steps to protect their liver health and prevent the progression of the disease. From lifestyle changes to medical treatments, there are various strategies available to manage fatty liver disease effectively. If you suspect you may have fatty liver disease or are experiencing any of the shocking signs mentioned, it is crucial to seek medical evaluation. Remember, early detection and diagnosis are key to preventing further liver damage and minimizing the risk of complications. Take control of your liver health today and make the necessary lifestyle changes to support a healthy liver. If you found this video helpful, give it a thumbs up, share it with others, and subscribe for more health-related content. Thanks for watching, and until next time, take care.